Hi, this is Julie Lubinsky. I'm the Associate Director for Digital for the Christopher and Dana Reeve Foundation, and I'd like to welcome you all to this webinar for Care for the Caregiver. It's hosted by Regina Rosenthal. She's a physical therapist, teacher, author, yoga instructor, and health coach with over 3 decades of experience in the healing arts and sciences. Her mission is to promote peace and world healing by offering opportunities to increase self-awareness and self-healing using mind-body techniques and self-care practices. So I'd like to now turn it over to Regina. Hello, Regina.
Hi, Julie. Thank you for yourself and the Christopher Reeve Foundation for giving me this opportunity to bring some information and experiences to increase awareness. And I want to thank all of the attendees for taking the time out from a very busy schedule and busy time to make some time for self-care. Please take a look at the Reeve Foundation's website and especially check out their Paralysis Resource Guide. They've got amazing, phenomenal resources. So without further ado, I'd like to take a look at one of the things that has had me always questioning self-care. As a physical therapist for over 35 years, I always asked clients, how do you remain healthy and resilient in a world that's filled with constant stress and change? And due to urging of the clients I was working with, I wrote The Heart of Healing, a book that is based upon the 7 themes we encounter in any healing process and self-care practices at the end of each chapter to help us become more active participants in our self-care, empowered healthcare consumers. So answering that question, clients continuously showed me that there were 3 solutions to maximizing health and well-being. The first one was to increase our self-awareness, and we're going to use sort of an awareness journal today at the beginning and the end of our practices so that we can get a better sense of, has what we've learned today been helpful to you, and are you curious and do you want to learn more either through a local practitioner or through a program. What you're learning today is offered in a class through Soul Lightning International. It's a nonprofit organization that I work with, and we teach acupressure programs to health practitioners and community groups. So we're going to increase self-awareness as a solution to staying healthy and resilient. We then want to use self-care practices, and self-care practices will be different every decade, every season. And so what you're going to learn today, this acupressure program, is a self-care practice. The more you bring into your toolkit, the more you have as an option when you're feeling the need for continuing with self-care, and that's pretty much an everyday practice. And the third solution after increasing self-awareness and using self-care practices is to reconnect with what has heart and meaning in our lives, what brings us joy. So as caregivers, there are many benefits. We establish strong relationships. It gives us a feeling of being needed versus helpless, and that's whether you're a family caregiver or a professional caregiver or just a caregiver for a significant other. It gives us an appreciation of time and life and simple pleasures and especially relationships. However, research has been showing that caregiving and stress are related, and when there's not a balance between the giving and the receiving on the part of the caregiver, oftentimes we have issues with health. Our immune system is impacted and reduced. There may be times when we feel depressed, and it can cause premature aging. So what are we to do? Well, when we look at the world today, there's many stresses that we face, many dis-eases, a lack of ease in the body that can come from illness, from aging, from multiple losses, from the way overrated multitasking and overscheduling. So when I look at stress, I like to consider stress as change. And stress is not necessarily bad. It gets us up in the morning. The issue comes about when we have distress, when we have too much stress at once, or too much stress over time, so chronic stress. And that's when our whole being, our body and our mind and emotions can't compensate or adapt. And that's when we notice the stress reaction in the body. And that's really hardwired in our limbic system. So just as the caveman, when something strange came at him, it was fight or flight. When we hit stress today, it's quite similar. This fight or flight response goes on. It's almost automatic. And when that happens, 80% of the blood leaves the forebrain. And I want you to think about when you get stressed, how can you think clearly? Can you focus? And most times the answer is no. And the reason is that the front of our brain is the executive, the CEO of the corporation that's called Regina or Julie or whatever, your corporation of yourself. And when the blood under stress leaves the forebrain, that executive can't make wise decisions. The reason we want to use self-care practices as soon as possible when stress hits, even if it's just some breathing exercises, it helps to get the blood back to the forebrain so that that executive, that CEO, can make wiser decisions. Now, when we're living every day, we deal with two parts of our nervous system. One is called the sympathetic branch and one is called the parasympathetic branch. So our sympathetic nervous system is fight or flight. It produces the adrenaline and the cortisol when we really get revved up. The parasympathetic is our rest and digest part of our nervous system. They're like a brother and sister. They work with each other. And the parasympathetic nervous system also produces chemicals like the serotonin, like oxytocin. And oxytocin, women have always been familiar with that because it is secreted during childbirth and when we nurture and nourish our children. And what they're finding is that oxytocin, which is a hormone, is also released when we have experiences with touch, when we are touched physically, or when we are touched through our presence, through our words, through social connection in feel-good ways. So we have a great deal of impact and control over the chemistry of our body. So when we're getting a lot of the adrenaline and the cortisol, we can use self-care practices to kick in the chemistry of the parasympathetic nervous system, and that will affect changes in our body-mind chemistry. So the goal is really to balance the chemistry of our sympathetic and parasympathetic nervous systems, and self-care practices are a very good way in which to do that. They're simple, they're time-efficient, and they're cost-effective. So how do we manage caregiver stress? Well, basically, we fill up, we empty out, and we repeat. Many times as caregivers, we don't fill up. And caregivers walk a tightrope with no net below it. And so we really need to make sure we are filling up. So we want to increase our self-awareness. When am I getting to the point where I'm on empty? And instead of pushing myself when I'm on empty, making time, whether it's a breath practice or a 5-minute nap or a 2-minute yoga practice, or some of the points you'll learn today on the acupressure program. So self-awareness tells us stop, look, and listen, and gives us an idea of, well, what do I need to do next? How do I need to be with myself next? It's also important to set healthy boundaries, when to say yes or when to say no. When we manage caregiver stress with self-care practices, it gives us a chance to build up our resilience and nourish ourselves through these practices. And it also helps us to reach in and connect with our internal GPS. We have an internal GPS in our being as well as we have in our cars that says stop, look, and listen. So we need to reach out for resources and as well as reach in to the internal GPS to listen to some of the guidance that we're receiving. And it may involve reassessing our priorities and our goals. So self-care is important for prevention. It's important for our physical, mental, and emotional health. It increases our flexibility, our strength and our immune function. And it's not only physical flexibility that self-care increases, but our mental flexibility, our beliefs and our attitudes, and where we may have to think more broadly or perhaps out of the box. Self-care practices also enhance our self-esteem and our ability to be empathic for ourselves as well as others. And self-care practices will improve our focus, our concentration, our memory, and our creativity as we get blood back to that forebrain. Self-care practices promote heart health and heart-healthy qualities such as gratitude and laughter and play and joy. And self-care practices such as the ones you're going to learn today are user-friendly and cost-effective. So when we look at wellness, I like to think of it in 4 dimensions: the physical dimension or the body, the mental dimension or the mind, the emotional dimension or our feelings, and the spiritual dimension or our life force. And there are different self-care practices that you may already be doing in these 4 areas, but physical might include exercise or movement. It may include nutrition and sleep. Many times we're not getting good quality rest, and that will affect our body chemistry. We need to also have time in the natural world. And making time in the natural world for self-care. So in the mental area, perhaps we're learning how to manage stress. We're working on self-esteem and how we talk with ourselves. And in the emotional quadrant, we may take a look at our relationships, our social connections. How am I communicating with myself and others? Laughter and play is a great, great self-care practice. And giving and receiving joy. And there are times when things are not joyful, and that may be where you go into another self-care practice to help you just regain balance. And then in the spiritual or the life force dimension, what's my path and purpose in life? What am I here for? Finding the beauty, I say the joy as well as the oi in life. And so we take a look at the gifts and talents and what am I here to bring into the world, whether it's a smile on my face or a call or just taking some self-care in my garden. So a self-care toolbox, I like to think of it as needing these qualities. It has to be empowering. It has to be user-friendly. It needs to be cost-effective. And it has to produce results. So what's in your self-care toolbox? What do you do for self-care? This is not a guilt trip, but it's a way of increasing awareness. What I can name and track, I can interact with and change. So think of a self-care practice that you do now. It can be sitting and breathing, having a cup of coffee in the morning, calling a friend, and just when you've done with this, notice and think back on how do you feel? And what differences does that self-care practice make in your life and perhaps in your relationships? So taking time, perhaps calling a friend, to be listened to as well as to always be on the end of listening to others. So today we're going to do a practice called the Seva Acupressure for stress release. This is a simple acupressure program, a method that was created after the events of 9/11. And it's practiced and taught worldwide through Soul Lightning International, that's SLI, and there'll be a link at the end of the webinar for you to be able to contact them. I'm in New Jersey. I don't know where each of you is calling in from, but there are practitioners in the states throughout the U.S., and you can go on the website and find out who's available, and either you'd like to learn this more clearly, or perhaps you'd like to go and experience receiving a Seva Acupressure session. The classes also, what's really good for caregivers is that the first class we learn how to do it on ourselves. So like on the airlines when they say put the oxygen mask on yourself, we're going to put the Seva practice, use it with ourselves. And then you can learn as a caregiver how to use it with the individual or individuals you're caring for, and that would be in the second class. Each of them is 3 hours, and they're very cost efficient. They're $60 a class. So you can look up more about this either by contacting me at my website or Soul Lightning. So getting back to that, it's been practiced and taught worldwide. It was used at Towson State with college students. This is a 15-minute, 20-minute tops program you learn to do with yourself. And it was taught to the students at Towson State who used it on themselves before exams. And they found that they not only had less stress, but they had better performance on exams. It's also been used at Walter Reed Medical Center with military personnel with positive results. And it was used at the University of Maryland Hospital with the first full facial transplant that was done there. And it was used by teaching this young gentleman who had been a recluse for 15 years because of a car accident that left him with major facial disfigurement. And they taught it to this gentleman, and they taught it to his family, and it was used for pain management. I've also used it personally. My husband has used it for morning anxiety, completed in 15 minutes, and says this has made a major difference for him. I've taught it to a 10-year-old with Crohn's and attention deficit disorder, and he used it in the mornings before he went to school, and it totally changed his behavior. So anyone can use Seva. Seva means compassionate service. For self-care, we can use it with family and friends. I've had moms learn how to do it for elderly parents or for children, for significant others. We can learn how to use it as health practitioner with clients, patients we work with, and use it with colleagues. So the Seva program is based on acupressure, which is based on Chinese medicine. So Chinese medicine and acupoints have a 5,000-year history. And in 1991, there is an article, if you Google the Iceman, you'll find this information, where a frozen mummy was found in the Alps and in Switzerland or Italy, I don't remember which one. And they dated the tissue, and the mummy was 5,200 years old. They noticed that there were 15 groups of tattoos on the body. And they were curious. They didn't know exactly what they were about. So they looked at the tissue further, and they found that the mummy had spinal and arthritic problems, inflammation. And when they looked at the tattoos, 80% of the tattoos corresponded to acupoints that were used for treating pain and inflammation. So we are using the same points as an acupuncturist would use, but we are using finger pressure instead of needles. And it is in Chinese medicine that they documented pathways that the life force moves through the body. And these pathways were called meridians. There are 12 meridian pathways, organ pathways, and there are 8 what we call reservoirs. They're extraordinary meridians that service the 12. And when we use acupoints, they're like little windows or doorways that give us access into these meridian pathways and the energy body. So what makes acupressure so effective? Well, we can see that it's over 5,000 years old. It's time-tested. We always carry our bodies with us, so it's accessible and convenient. It's simple, safe, and it's been proven to be effective. And it's a way of using self-care to bring compassion to ourselves. So energy has been called chi or prana. It moves through the body. It rises in the morning. That sympathetic nervous system gets us up out of bed, and it falls in the evening, and that's when we look to sleep to restore our body. And we see that energy moves in waves, and where it moves and flows, disease, any kind of dis-ease in the body has less of a chance to thrive. Sometimes these meridian pathways get crimped like a garden hose, or they can get congested around the acupoints. So we want to use acupressure to keep the energy flowing and to open up congestion at the points. Now, if you'll notice the up and down of this wave is kind of, I don't know if you can see the green line, but it's staying within a zone that I like to call the zone of resilience. So this zone of resilience is where our body basically can bounce back. But sometimes energy doesn't stay in this zone of resilience. Sometimes it goes way up. We could have won a lottery ticket. Or sometimes it goes way down, where we become ill, we become fatigued and exhausted. So we bring in a self-care practice, and what that does, it helps to bring our energy back to the zone of resilience, back to a place where the body can compensate, back to a place where we can think and focus more clearly during or after stress. So we want to get the nervous system balanced. We want to think clearly. We want to change the chemistry within our being and help it balance more. So I'd like to start. The Awareness Journal was given to me by Betsy Baker, my mentor, who's an acupuncturist in Maryland, and she had me keep a very brief journal. Check in with myself 3 times a day, morning, midday, and evening. And she had me look at what did I notice in my body, what sensations, not necessarily bad, but what did I notice in my body, sensations, temperature, tightness. Then what did I notice in my mind? What was my self-talk? What was the belief or attitude I had for that day? And what was happening in my emotions? I also took a look at what was my life force telling me that day. Was I really happy and feeling balanced, or was I having a hard time because maybe I was becoming too much of a human doing versus a human being? I wasn't looking at, did I have gas in my tank? And we often take better care of our cars than the vehicle we travel through life with, our body. And so we have to become aware of when do we need to put gas in the car. We wouldn't leave the house in our cars without gas in the tank. We also need to take a look at when do we need to put on the brakes. When do we need to make a right or a left turn or a U-turn and go back? Or when I need to just stop and get out of the car. So if you're keeping an awareness journal, you can do that 2-3 days a week, just morning, noon, and evening. Check in. Start noticing at the end of each day what patterns, physical patterns, mental patterns, emotional patterns that you start to see. What we can name and track, we can interact with and change. We can support what is really helping us and start to consider changing what doesn't work anymore. So for today, what I'd like you to do is on a 0 to 10 scale, 10 is the most and 0 is none. I'd like you to just think about what would you rate your pain or stress in this moment, 0 to 10. 10 would be the most and 0 is none. So whatever number it would be, and we're going to ask the same question. What would your rate of pain or stress be now at the end to see did what we used today and learned today make a difference? So before we start, you've got that number. Some questions that people ask before they start using acupressure. So they ask, do I press straight in? In our system, we use a little curve at the acupoint, so it feels like a comma. I think of it as a happy face, and what that does is it helps to gather the energy around an acupoint. People have also asked, how deep should I press? And this will vary. This is where you feel and listen to your body. If I'm pressing excess baggage, which we'll learn today, which is at the top of my shoulders, that's where I store my stress. Many of us store stress. There's a lot of muscle tissue there. If I use a point at the elbow, which we'll also learn today, there's less muscle tissue there. So we may press more or less depending upon where the point is. And also, more is not better. If one point that we're using today is sore, pressing deeper into that point is not necessarily better because it can drive the stress and the pain deeper in the body. It's like guarding and then it goes in deeper. So listen to your body and feel how deep the pressure feels. Good, or do you have to lessen it? And then what should I be feeling? You may feel nothing. You may feel warmth. You may feel a chill, you might feel a pulsing, or you might feel a softening of the tissue around you. And in this system, we're going to do the same point on both sides. So we're going to use one hand for the right and one hand for the left. If you find that you don't have the ability to use one or both hands, just imagine that your hands are moving there. And caregivers can learn this program if that's the case, where you don't have full use of your hands or either hand. So caregivers can learn to do this with the individuals they're working with. So here we go. We're ready to begin. We're going to start with the first point. So we start with a leg stretch. I usually advise people not to go into full forward bending posture, but to sit in a chair. So position yourself in a chair now, in an upright position. And as you do that, just let your legs stretch out. You don't have to forward bend. Imagine that your heels are moving away from you. You're flexing the ankle. Again, if you don't have movement in your legs, just imagine this. Moving your heels away, lengthening the legs. That's our first point. The leg stretch. Seated can also be done lying down. We're going to come to the next point, which is the middle of the back. So again, you're either imaging or moving your hands right and left to the back body. You're going to be at the bottom of the rib cage on both sides, about an inch away from the spine. Again, imagine that. If you can't get your hands behind your back, you can go to the dollar store and buy 2 pink balls, the hand balls, and stick them in a tube sock and tie a knot on the outside of each ball. So you've got 2 balls in a tube sock, and they can be placed behind you, and you can lean into the ball. You don't have to bring your hands to the back body. So let's just feel that, either imaging it or feeling your hands back there or imagining the 2 balls. Breathing in, we usually take about 2 or 3 breaths, so I'm going to have you breathe in. And then on the exhale, see if you can make your exhale longer than your inhale. So if you inhale to a count of 3, exhale to a count of 4, 5, or 6, resting back and being supported. We're always on the go. We're always ready for the next thing. And let your back and your whole being rest back. Usually take 2 to 3 breaths with each point. And we're going to move on to the next point. This is a point called back drain, and the point is in the middle of the crease on the back behind the knee. So I usually bring my hands around. I tend to use my middle finger into these points. So we have our right hand behind the right knee, our left hand behind the left knee. And we're just pressing with our middle finger into the crease. Put a little curve into that, a little happy face. Taking 2 or 3 breaths into these points. Back drain is a great point to help relieve stress and tension in the low back. So taking in some breaths. As you hold these points, it may feel different on one side versus the other. One side might release quicker than the other. 2 to 3 breaths. And then we move on. There will be a picture handout with each of the pictures on the slide that you'll be receiving from the Reeve Foundation. You'll also be able to get a link to the webinar that you can use to review this, because you'll learn about it in this webinar, but you'll need to practice. So you'll have several ways of remembering. So now we're going to move up and bring our hands to the top of the shoulders. This point is called excess baggage, and it's for all the baggage we carry on our shoulders. And you can either put your right hand on the right top of the shoulder and your left on the left, or you can cross them in here, as you see on the picture, and right hand, middle finger goes to the left side, left goes to the right. Press down into the top of the shoulders, put a little curve into it, a little happy face, and breathe. Take the breath into the shoulders. See if you can even bloat your belly. And then exhaling, making your exhale twice as long. 2 to 3 breaths. Now, if your hands are not crossed, we're going to cross them and bring our right hand to the top of the left shoulder and our left hand to the top of the right shoulder. And we're going to come to the next move, which is to take and move down both arms to the elbow crease. And we're going to press, and you'll notice here that the fingers are right in the elbow crease. So we can use our middle finger from our right hand on our left elbow and the middle finger on your left hand at your right elbow. And put a little curve pull into the elbow crease. So we're not over the bone, we're over the soft tissue. And if you look at your elbow, you'll see there's a crease there, and you can just put a little pressure with a fulcrum, with what we call a fulcrum. That's that curve pull, place where change occurs. Breathing in 2 or 3 breaths as we hold the elbows. These are points on the large intestine meridian. They're helpful to boost the immune system. It's also good because it's giving ourselves a hug. And then with our right hand, we're going to move from the left elbow down the right forearm, and we're going to move down and out each finger. So I'm going to move my hands, my right hand down and out through my right thumb. I'm going to squeeze the sides of the nail on my right thumb. I'll next come down through my index finger and squeeze the nail beds, the nails on the side. Continuing with my right hand down the left middle finger, squeezing the sides of the nail, down through my ring finger on the left hand, squeeze the sides of the nail, down through the pinky, squeeze the sides of the nail. And now we're going to switch. So you're going to move your left hand to the right elbow, and again, down the right arm and out each fingertip of the right hand, squeezing the sides of the nails of each finger, down through the thumb, down through the index finger, down through the middle finger, down through the ring finger, and down through the pinky. The next place we're going to come to is we're going to bring our hands to the bottom and the back of the neck. And this will be a massage type of movement, so what pressure feels comfortable. And we're going to put our fingertips on both sides of the bottom back of the neck and move them up and over the bottom of the skull, up and back to the top of the skull. And then we're going to bring our fingers on our right hand to the middle of the forehead and on our left hand to the middle of the forehead. And then we're going to do a brow sweep from the middle out with both hands. So we started, you may want to do it again with our hands to the bottom and back of the neck, moving up both sides of the back of the neck, over the bottom of the skull, up the back of the skull to the top of the head, and then we're going to gently sweep across the forehead. We call that a brow sweep. We're going to be using this point again later on in the program. So after we've done the brow sweep, we're coming to the point below the collarbone. So we are under the collarbone, and we're not in the center of the chest, but more out so that we're at a point that would be over the line of the nipple. And we're going to be between the sternum, the chest bone, and the shoulder joint. So another way of finding it is to stretch your index finger and your thumb, put your index finger on the base of your chin, and then open your hand and your thumb should be below the collarbone. That would give you an idea of the line in which to find that point below the collarbone. So breathing into this point, it's easy to put a nice little curve pull into this point. This point has branches. This is on the stomach meridian. It has branches that go deep into the chest to help relax the heart and the lungs. And anytime we're under stress, the heart and the lungs are stressed and the rib cage becomes a cage. So it's actually harder. The lungs and the heart have to push against this cage. If we can enhance breathing, it'll not only change chemistry, but it'll help the heart and lungs not to have to work so hard. So again, breath into this point as you're holding under the collarbone. And next we're going to come to a point that is on the right side and then on the left. So we're going to start with the armpit and wrist on the left side. So we take our thumb of our right hand and we bring it up and into the left armpit. We bend the left arm at the elbow, and then we use any of the fingers on your right hand to touch a point on the left wrist. And this point is right below the pinky side of the wrist. So we have the thumb of the right hand in the left armpit. The fingers are not under the armpit but outside. And then we take a finger, any of the finger, could be middle, could be pinky, to the wrist, on the pinky side of the wrist. And we're holding these 2 points. So I'd like you to breathe in. This is the beginning and almost the end of the heart meridian. It has a very calming, soothing effect on the body. And many times when I'm using it or using it with others, I find that the shoulders tend to drop and release. Releasing tension in the heart, breathing in and breathing out. And we're going to do the same thing now on the right side. So we gently release the armpit and wrist on the left, and we bring our left thumb into our right armpit. We bend the right elbow, and we bring a finger onto the right wrist on the pinky side. And we are holding our left thumb in the right armpit, and a finger from the left hand onto the right wrist, down by the pinky side. Breathing in and breathing out. Again, knowing that we are connecting with the beginning and almost the end of the heart meridian. I had a journal and it said, when your heart speaks, take good notes. So you'll start to notice that your heart starts to talk to you because we're listening. You will also, after this webinar, have access to a Facebook Live event that I did on the Seva program for the Reeve Foundation. These 2 points, the armpit and wrist on the right and left, are the only points that I mistakenly left out in that program, but you'll have the webinar to refresh your memory about that. So we gently, after we've taken in 2 to 3 breaths, we release the right armpit and wrist. And we move on to, again, the heart. So we're going to bring our hands right over our heart. So we're in the middle of the chest. This point is called Sea of Tranquility. I love the names of these points in Chinese medicine. And we're going to inhale and exhale. Imagine your heart is a balloon. Imagine that you're taking in energy into this balloon, filling the front and back of the heart, the top and the bottom, sides. And on the exhale, the balloon deflates. Again, breathing in. See if as you sit in the chair, you can feel your back body expanding. We don't oftentimes breathe into the back of the lungs, and it's really helpful to clear that. So breathing in, expanding the balloon with the inhale that heart is, and the exhale, releasing, letting the balloon deflate. One more, inhaling and exhaling, And especially during stress, what you can do is inhale through your nose and exhale here for this point as if you're blowing out a birthday candle. So it would be an inhale through the nose and imagine you're just releasing whatever stress is in the heart that you don't need at this moment. So we're going to come next. We've gone up the back body and down the arms, and we're going to come down the front of the body. And we're bringing our hands to the bottom of the rib cage on both sides. This is called the Gate of Hope. You get to make a wish here. And breathing in so that you feel your hands moving as your rib cage widens and maybe moves forward. And on the exhale, you're giving yourself a very gentle hug, squeeze. So inhaling and exhaling, this helps to open and work the diaphragm, which is a muscle that works with breathing. Again, if you don't have use of the diaphragm muscle, just imagine that this is like a dome that's moving down on the inhale and rises on the exhale. One more breath. And then we're going to move on to the point that is below both kneecaps. So here we're bringing our hands either in this picture with a thumb on the inside and the hands on the outside, but we are working at the top of the shin. So we are below the knees. We are at the top of the shin. And sometimes what I find that to do the hands at the top of the shin, we may bring our palms on the outside and let the fingers just curl in so you're hugging around the top of the shin bone. The right hand on the right shin bone, the left hand on the left. So breathing in and breathing out. We're on the top of the shin, below the kneecap. And as we breathe in, we can appreciate we're learning about taking a stand and where we stand in life. Good. So now we're going to move on, and we're going to meet our front back drain again. So back drain is that point that's in the middle of the knee crease on the back of the knee. So we have our right hand on the right side in the back of the knee. Maybe we're using our middle finger to put a little fulcrum, a little curve into the back of the right knee, and our left hand behind the finger behind the back of the left knee, putting a little fulcrum in, a little curve pull. And what I can often suggest is that we can keep our hands in this position behind the knees, but we're going to add the toes. Now, a good way to do this together is while your hands are behind the knees, take the sole of your right foot and cross it over if you can so that it's on top of your left toes. So we're breathing, we're holding behind both legs. We move the bottom, the sole of the right foot so that it comes over the toes of the left foot. 2 to 3 breaths. And then we keep our hands behind the knees. We release the right foot, and we bring the left foot now, while we're holding the back of the knees, we bring the sole of the left foot over the toes on the right foot. And breathing in and breathing out. Usually we keep our hands behind the knees. We take 2 to 3 breaths as we put the right foot over the left toes. We then switch our feet while we're still holding behind the knees, and we bring the sole of the left foot now covering the right toes. Again, if this is not possible for you, imagine that you're doing it. The brain doesn't understand the difference between the real and the imagined at times, and so you can get many benefits just from using imagery. So we do these for 2 to 3 breaths. We then release our foot, the left foot off the right toes. We gently release the hands from behind the knees, the fingers. And here we're going to do the neck stretch again. Neck stretch is really important because when we're under stress, the head becomes like a cork in the bottle. And so when we do this neck stretch and the brow sweep, it opens up the neck and again helps the circulation, the blood, the veins, the vessels that go into and out of the head to be able to circulate again, including the fluid that bathes the brain and spinal cord, the cerebrospinal fluid. So we bring our hands to the bottom and back of the neck. We move up both sides of the back of the neck, over the bottom of the skull, up the back of the skull to the top of the head, using as much pressure as feels comfortable. I'd like to suggest that when you're doing this, that you have a chair behind your head so that you can support the head. It doesn't have to be forward like this. So imagine you're sitting and that you have a high back chair and you can use that. And we've brought our hands to the bottom and back of the neck. We've moved up both sides of the back of the neck, over the top of the skull, and then we bring our hands to the forehead, right and left, from the middle to the outside, doing a gentle brow sweep. People really like this. This is really one of the points that's really very valuable. And you're going to find that there may be certain points that you like and that you notice a big difference in your body using them. Obviously, the points are put together in a recipe. These 15 points were taken out of a 36 acupoint protocol and used at Ground Zero, and it was felt by the teachers who put this together that these were really potent, significant points. So, yes, you could use them independently as a self-care tool. Doing the whole thing together works best. So next we come to the last 2 points of the program. We're going to bring our left hand to your tailbone at the bottom of the spine. And again, you can use the balls there if you can't reach, or you can imagine. And your right hand is going to come and be placed very lightly, no pressure, on the top of the head. And on this point, I'd like to have you breathe from the tailbone on an inhale up to the crown, and from the crown, exhale down and back to the tailbone. So we're doing a circular breathing. Another great tool. Inhale from the tailbone up to the crown, the top of the head. Exhale down the front and back to the tailbone. This breathing is over 2 meridians that are the first to form in the fetus. And so the governing vessel, which comes up the back body, on the inhale, we're breathing into and through, and then we're exhaling down the conception vessel, which comes down the front of the body. A great tool just to use in and of itself. You can do 2 to 3 circular breaths, inhaling and exhaling, inhaling and exhaling as you hold these points. If you can't hold the points, again, just imagine the breath as an elevator coming up the back body and then coming down the front of the body. And here we end with the leg stretch where we started. So the leg stretch, the point behind the knees, the neck stretch, and the brow sweep are points that we use more than once. So I'm going to go back and just really, let's just do a quick review so we can repeat through this a second time, and maybe it'll start to make more sense of it. Again, you can listen to the webinar. And let's see if we're going back. Okay. All right, let's see. Let's get back. Okay. So here we're going to start again. Let's repeat this, starting with the leg stretch. Heels are lengthening. You don't have to forward bend. Many times that's not good for people with back issues. So we bring the heels lengthening. You don't have to lift both legs. You can lift one leg at a time and stretch each from the heel, lengthening, flex the ankles. After the leg stretch, we bring our hands to the back body on both sides of the spine, bottom of the rib cage. We're about an inch away from the spine. Breathing in and breathing out. Resting back and being supported. Now you'll notice that this is done lying down. It can be done seated or lying down. And then we come to the next point. So we're moving our hands from the back of the rib cage to behind the knees on both sides. We're in the crease at the back of the knee, and we're using a finger to come in and press into that knee crease at the back of the knee. A little curve into that, little happy face. And then we're going to gently release that and move on to the top of the shoulders. Excess baggage. And we're going to either keep our right hand on right side, left on left, or we're crossing them so that the right hand is at the top of the left shoulder and the left on top of the right. And we're pressing down. We're putting a little curve into the pressure point. And we're coming into the top of both shoulders, the trapezius muscles. A great place to inhale and bring your breath into the shoulders. And then on the exhale twice as long. Helps to release tension in those shoulders. Next, we take our hands, we cross them so that a palm is on the opposite shoulder, right on left shoulder and left palm on right. And we bring this awareness, this energy down both arms to the elbow crease. We put a little curve into the elbow crease, the acupoint there, helpful with the immune system. And then we come down and out, down the forearm with your right hand, down the left forearm, out each finger, squeezing the sides of the nails on your left hand, and then bringing your left hand to your right elbow, bringing the energy down through the forearm, out each finger, squeezing each nail bed. And again, seated or lying down. And then we come to the neck stretch and the brow sweep. So we bring our hands to the bottom and the back of the neck. We move both our hands up the back of the neck, like you're squeezing a tube of toothpaste. As much pressure as feels comfortable, over the bottom of the skull, up the back of the skull, to the top of the head. Again, if your head can be supported so your head is back over your shoulders, that was really a better position. And then we bring our hands when we reach the top of the skull and we sweep gently across the forehead with our fingers on both hands for a brow sweep. You may find when you do this for yourself after the webinar that you like to do this 2 or 3 times. It's very relaxing. And from the neck stretch and the brow sweep, we bring our hands, starting our trip down the front of the body to below the collarbone. We're in line with the nipple under the collarbone, right hand on right side, left fingers on left side. We put a little curve into happy face, into the point, breathing into these points. Remembering there's branches that go deep into the chest to help promote better relaxation and releasing tension from the heart and lungs. After this, we come to armpit and wrist. So here we're doing the beginning and almost the end of the heart meridian. So we take, and again, it doesn't matter if you start on the left side or the right side. So I'm taking my right thumb and I'm putting it in and up into my left armpit. I bend my left elbow, and I use any of the fingers on my right hand to connect with a point that's on the wrist on my left arm, on the pinky side of the wrist. Breathing in and breathing out. And then we very gently release this. I would normally hold it longer. And then we bring your left hand, your thumb in and up in the right armpit. You bend your right elbow, and you use any of the fingers of your left hand. You bring them to the wrist on the right. on the pinky side. So you've got a thumb in the right armpit and a finger at the right wrist on the pinky side. Again, 2 to 3 breaths. You may feel the whole shoulder dropping, releasing tension. We then bring our hands over our hearts, breathing in and out, filling the balloon. We then brought our hands over the bottom of the rib cage, this gate of hope, and we took 2 to 3 breaths in and out, helping to relax the diaphragm. We then brought our hands to the top of the shin, and I said that you could either do it this way from above, or you could put your right palm on the outside of your right shin, and then your fingers curl around to come to the inside of your right shin, so we're below the knee. And then we can use at the same time our left palm on the outside of the left shin and bringing our fingers around. So we're doing both sides at the same time. We then came to the back of the knees. We're visiting back drain again, so we're in the crease behind the knees. Middle finger, or a single finger, is coming up and putting a little curve into the back of the knee. And at the same time, we're keeping our right foot over the sole of our right foot over our left toes while our fingers stay behind the knee. Then we release after 2 to 3 breaths the right foot, and we bring our left foot, the sole of the left foot, over the toes on the right foot. Again, 2 to 3 breaths. And from there, we did a neck stretch and a brow sweep again. So hands to the bottom and the back of the neck, like a massage, like you're squeezing a tube of toothpaste. They move up the back of the neck, both sides, over the bottom of the skull, up the back of the skull to the top of the head. And then we sweep gently across the forehead for a brow sweep. We then bring one hand to the tailbone, the coccyx, the left hand, and the right hand comes to the top of the head, very light pressure, holding that with a circular breath, inhaling up the back body, exhaling down the front body, and then we end with the leg stretch. So again, we don't have to forward bend. We can just lengthen our legs. So now what I'd like you to do is I'd like you to take a look at that same rating we did when we started. What was your rating for pain and stress? 10 was the most, 0 was none. And do you notice any change in that level? And what's the change? It may be in your body. It may be that your mind calmed down. So I want to thank the Reeve Foundation for providing this time for each of us as caregivers in our lives to appreciate how significant self-care is, to remember self-care is not optional, it's mandatory. Parker Palmer, who's an educator, says that self-care is never a selfish act. It is simply good stewardship of the only gift we have, the gift we were put on this earth to offer to others. Anytime we can listen to our true, authentic self and give it the care it requires, we do so not only for ourselves, but for the many others whose lives we touch. If you're curious, and hopefully some curiosity has been piqued, and you want to learn more either about practitioners in your area or where in your area the Seva program can be taught or is being taught, you can contact Soul Lightning International, and there is their website, www.soullightning.com. If you're interested, you can call them on Tuesday to Friday between 10 and 2. The registrar is open. The number there is 978-456-0300, 978-456-0300 to check out Seva programs and practitioners in your area. I'm in New Jersey. So if you're interested in experiencing more with Seva or bringing a workshop to your community, I teach at the community colleges, I teach in the Vo-Tech schools. So if you're interested in learning about when I'm available, please contact me at my website, reginarosenthal.com. There are continuing education credits for the Seva programs, Part 1 with yourself, Part 2 with others. Each of them is a 3-hour class, and they're very reasonably priced at $60 a class. There is continuing education available for both of them, for nurses, massage therapists, and acupuncturists. And I want to thank each of you for making time for yourself today. It changes the world. The Dalai Lama has said that although changing the world one person at a time is difficult, it is the only way.